My name is Gordon Gregory for the next 3 or 4 months at least. Special welcome to all of you again. Thanks very much for coming. When we first initiated this information session, we thought we might have 25 or so people in a dark room somewhere talking really nerdy stuff, and it's great to see that we've got 130 people registered, and so there is really strong interest in this. So that's good. Welcome, everybody. Housekeeping first. The toilets at that door across the walkway, women straight ahead, men a bit to the left. If there's some sort of emergency, you will hear about it at the same time as I do. And you can go through that door and left out into the garden area, or you can go out that way and right and onto the lawn here. So I'm sure we'll find safety by looking after each other, as Matilda said, and going left or right out of that door. If those of you who are tweeting, hashtag Modified Monash, please. Those of you who want to use Wi-Fi, the Wi-Fi address is here on the screen. It took Andrew Phillips and me an awful long while to persuade Leanne and Sue that we could afford a sandwich. So please, at 1 o'clock, please, enough of you stay to make sure that we do actually use the sandwiches, otherwise it will have been wasted effort. So the purpose of the day is clear, I hope, to everybody. That is, we're here to find out what Modified Monash is, where it came from, what it can be used for, what it can't be used for, what its benefits are, what its costs are, what agencies are thinking of picking it up, and so on. So that's the overall purpose of the day, which if that's not what you're here for, then you can leave quietly now through the back door. I want to acknowledge straight away not only Paul, David, Sarah, Martin and Louise, but the agencies for which they work, because the National Rural Health Alliance is very pleased and proud to have a good working relationship with the agencies, with the Department of Health, with the ABS, with the Australian Institute of Health and Welfare, with the Independent Hospital Pricing Authority, with AHPRA, and with National Health Performance Authority, while it's still able to be described on its own. So it's critical for the National Rural Health Alliance that we have these relationships with the data agencies, the national data agencies, and it's a great importance to us. Obviously, the work that we do is always based on good evidence, and as Matilda has said, it comes from the ABS and the other agencies I've mentioned, so I want to acknowledge that. I also want to pay special credit to Matthew McGrail, who is in the room here at the front. Matthew is one of the original architects of Modified Monash, so I expect him to blush very gently every time the word Monash is mentioned, which will be a lot of times during the course of the day. So Matthew, welcome. Get your blushing face on if you wouldn't mind. I suppose I should mention the one that worked with him. I know there are lots of colleagues, but I need to mention the one who is always mistaken for myself, John Humphreys. I don't look at all like John Humphreys. I hope you would agree. I'm much better looking than John, and even though the camera's on, I'm quite proud to say that. Of course, he's a close friend of mine, otherwise it wouldn't be so rude. There is some late-breaking good news, as it were, on the data front. Those of you who have found it always frustrating to have to go to various different places for data relating to rural and remote health or well-being will, I hope, be delighted to know that just last week the National Rural Health Alliance published on its website what we call, rather facetiously, our little book of numbers. So Andrew Phillips, again, who I want to give credit, has taken the lead on this. But you will find on our website the little book of numbers, which of course is huge, which is a single place to which you can go for all of the information, or most of the information you might want about rural and remote well-being. So it's got the demographic basis, it's got the industrial numbers, it's got some of the prevalence of conditions, illnesses, it's got workforce data and so on. So I do commend to you the little book of numbers, which is on the NRHA website. The National Rural Health Alliance, of course, is uniquely placed to run a service such as today to the sector, and indeed to the wider Australian community, because of course I'm conscious of the fact that even though the Rural Health Alliance's main interest is in rural and remote areas, this is not, Modified Monash is not actually a rural instrument. It's an instrument across the boards, but you'll pardon me if I occasionally lapse into what is our main job, and that is the rural and remote aspects of well-being in Australia. But what I'm saying is that the National Rural Health Alliance is uniquely placed to provide this as a free service to you and to the rural remote health sector. Having said free, I recognise, of course, that many of you have travelled a long way and the cost to you and your workplaces has been substantial. But the fact that the Rural Health Alliance can present this sort of event for the sector and for the health sector more broadly in Australia is, of course, down to the fact that we have a core grant from the Department of Health, without which we could not exist. And we're looking forward to negotiating with the Department of Health for the new triennial grant, which will start for us July the 1st next year. So I do want to acknowledge the Department of Health and its continued support for us. This information session is being filmed, the purpose being to publish it on our website as soon as we can after the event. I'm told that not only did we have 130 or so people register for today, but we had perhaps even 100 people who said they would like to be here because the matter we're discussing is of importance to them. They can't be here, but please can they see it online afterwards? And the answer is yes. So you will be able to see the presentations online as soon as possible on our website. I should point out that the fact that we are filming you, of course, we don't do this without your permission. So anybody who's speaking or who asks a question who doesn't want to be filmed can either get a large brown paper bag and hold it over their head, or they can give me or one of my staff notice of the fact they would like to be excluded. Also, because we're trying to capture the whole of today's events, obviously we don't want to stop you from howling out questions, but to the extent that you would like to be recorded in order to capture the fulsomeness of the day when we come to the question session later in the morning, which is very important to us because, as I say, the main purpose is to make sure you are provided with the information you need and want about Modified Monash, so questions are important. So I guess what I'm saying is if during the course of the morning when the speakers are speaking, by all means yell out something if it's really critical at the time. Make sure you yell loudly so that you can be recorded by the microphones, but more properly and more usefully perhaps save your questions until you can be on mic and recorded by our good friend Hector here so that we can capture your question and the response to it from whoever replies. Can I ask, is anybody here deputed to represent Minister Fiona Nash? Because it's a serious question. I'm not being flippant because there was to have been someone here, but I suspect probably I'm it. That's okay, I can do that. The point being that the matter we're discussing today, Modified Monash, is, as you all know, of great importance to the Abbott and Turnbull governments, of great importance to Minister Fiona Nash, the Minister for Rural Health. She actually announced, as you will remember, she announced formal adoption of the Modified Monash 13 months ago at the Rural Medicine Australia conference, which no doubt some of you were at in Sydney. So for a long time now, this has been a significant element of what the government has done specifically for rural and remote health, because you will remember, I don't want to steal any thunder from Paul or anybody else who's going to speak, but you will remember that the main thrust, if you like, for adoption of a new system was the campaign, the complaints about the anomalies in the old one, anomalies which were critically important because, of course, the system that we're discussing today can be used and is being used for some real things, including the distribution of financial incentives. So what I'm saying is that the Modified Monash has been formally adopted by the Minister Nash a long time ago, and I suspect the reason that she's not here to join with us and to open the session is that I understand she has been unwell, and I think her appointments have been building up in such a way that during the last week of sitting she's unable to be with us. But I'm sure she's with us in spirit because I know how important this is to her. I want to acknowledge also GISCA, which the last time I had close relationship with it was the Geographic Information Systems Collaboration of Adelaide, but I gather now it's called the National Centre for Social Applications of Geographic Information Systems. GISCA, incidentally, I discovered this morning, the word GISCA is goose in Romanian. It's amazing what you can discover on the internet, isn't it? But the point about GISCA is that GISCA has been, as many of you will know, has been heavily involved in the foundational work relating to these sorts of things, including ARIA, much known and loved to many of us. And I had a lengthy email from our old friend Errol Bamford, which is one of the reasons why I'm acknowledging GISCA. But the other reason is that very sadly, and I wasn't aware of this, Graham Hugo died on the 19th of January 2015. So Graham Hugo was a very highly renowned demographer and was the head of GISCA. And he died on 19th of January 2015 following a short battle with lymphoma. So I do want to acknowledge the work that Graham and his organisation led over many years, and indeed is still undertaking. I think I'm rounding up. I'm just wondering whether I've covered all the things that should be covered in an opening address, because of course, if you're following your program closely, which you're not because you're all listening carefully to me, you will notice that the time that I had 5 minutes, which I've exceeded, but of course I've absorbed some of the time that would have been taken up by Fiona Nash in her opening address. So unless you can think of anything else, anybody shout at me if you think I've missed something I should say in a formal opening address. I just want to welcome you. This is important. This is clearly not the end of anything. It's the beginning of a process by which we come to know and love Modified Monash and use it properly and not use it improperly. So I say again that the Rural Health Alliance is in this matter for the long haul, and this no doubt is the first of many activities that we will run and be pleased to run with and for you in order to make sure that we have a system which we're all pleased with, understand and can use to the full extent possible. So thank you very much. Now, can I invite Paul Cutting to talk to us? Paul, we had a teleconference with Paul recently, and I won't embarrass him very much, but I will say we were talking about things like intellectual property and who owns Modified Monash, and Paul said quite categorically, I do. So would you please welcome the party who owns Modified Monash, Paul Cutting.
Hello everyone, I want to thank